This is the thing. She copies me, guys. Okay, get this. So she's derm and she married a cardiologist.
Wait, hold on. No, you have to like go back. You have to go back. So
Copycats,
basically,
okay?
Dr. Ozzy is
I
Persian.
became a dermatologist. You became
Wait,
a
okay,
dermatologist.
wait, back up.
I
wait,
married a
back up.
cardiologist. You married a cardiologist.
I can't tell if you like. Welcome to the More Than a Pretty Face podcast, where we go more than skin deep to explore the science behind beauty and how you can look your best at any age. This is my podcast. I'm Dr. Mina, and I'm taking over.
All right. Is there something I should know, guys? Did somebody change that?
I'm actually Dr. Ozzy.
Actually, you know what? You're the co-host. Like that's my line.
No, you're the co-host.
Is this something I don't know, guys? Guys, come on. Something I don't
You're
know.
like Kentucky. Something has to stop. Okay, no, it's your podcast. I'm just kidding.
Okay, fine. You be the guest. You be the host. You try it out. You see how it is.
It's hard. It's hard work.
You were doing a great job, so I'm just.
What if I just walked a day in your shoes? Everyone was expecting to see
that
you.
Would be great. Wouldn't that be funny?
I think it'd be really funny. Do you think people
Well, some
would
people
notice?
say we look similar.
Yeah.
You know? I think that would be hilarious. I think we should plan a day.
Yeah. They would be like, did you change your hair or did you change something's a little off? You know? I think that'd be really funny.
Well, guys, this is Dr. Mina. If you didn't listen to our previous episode, go and listen to that and learn about her and her background. Because you recently finished your residency a couple years ago, right? And we have a lot of people that listen to the show that are aspiring to go into dermatology or want to learn a little bit more about the process of dermatology. So tell us a little bit about how you got to where you got today in terms of landing a dermatology residency, because it is the most competitive field to get into. And any tips and tricks that you have for people?
So I definitely feel like it gets more and more competitive every year, and it's not an easy task to match. But I think that if it's something you want to do, you should 100% go for it. And I think that most of it is believing in yourself and motivation and not giving up, because I'm sure you also got a lot of people telling you how hard it was.
I did, yeah.
Yeah. So I think most of it is just hearing a lot of people say negative things about it, but just still pursuing anyway. So I think actually most of it is that and not giving up. And then on top of that, doing well in school, basically doing well on the board exams, studying very hard. And I think what really helped were my clinical rotations, because my school didn't have a home program. So I had to really put myself out there and really meet different, program directors basically while I was doing the rotations and have them get to know me along with all the attendings. What I think is really important to know is that everyone you meet matters. So just be on your, best, nicest behavior to everyone, like even the secretary.
Be nice to everyone.
Yeah. From the front desk staff all the way up to the program director. Everyone's important. And not that anyone would be rude to any of those people, but you never know who actually would really influence the decision. But like, especially the residents, like it's really important to get the residents to like you on those away rotations. Doing a lot of research is really helpful as well. So I did a lot of papers during my third year, and I think now it's more common to take a break between third and fourth year and doing a research year. So that's very important. And if you're able to do that, I would definitely recommend, because step 1 is pass fail now. Crazy.
That's crazy, because that was the score that you needed to get, like a really good score on step 1 to even be considered in the pool.
So now I think there's more emphasis on step 2, which I think is better because step 2 is more clinical and a little bit more straightforward to study. So I think it's better.
I think that, putting yourself out there and really getting to know different program directors, residents, different people is really helpful, because then they really get to know you.
Yeah, right? Because a lot of people applying for dermatology, they have all of the great scores, and on paper they can all look really similar, but what makes you different is who you are. And
people would say, dermatology, oh my God, that's impossible to get into. That's like, you can't do that. Like, it's impossible. Don't let people talk you out of it.
Right.
If your heart is set on it, go for it. Just block all of that negativity out of your ears.
Yeah, I literally had someone tell me that you have a better chance of winning the lottery.
Yes, which is so discouraging. Like, why would you say that to someone?
Yeah.
So believe in yourself. Anybody can do it if you really, really want it. And that was those some really good points. I like that. I agree. So we are going to be answering your questions from Instagram and DMs that we've been getting from our followers. But before we get started, I wanted to tell you that when we were in Vegas, you had mentioned that I should watch Gossip Girl's
Uh,
new version without Blake Lively, right?
yeah, and the original Gossip Girl is the one to
Yes. So
watch.
that was a great tip because
Yeah.
then I'm now obsessed with it. I'm like on season 3 or 4. So
Okay.
before we get into the questions and the meat of the episode, tell me, what show are you
So
into
you should
now?
watch Bridgerton. Have you watched Bridgerton?
No, but I hear
Oh
about
my gosh.
Bridgerton all the time.
They
I thought it was a
all
game, Bridgerton,
I
but
don't
it's a
know.
TV
Yeah, yeah,
show.
it's a TV show. I think it's based on books.
Uh-huh.
And so is Gossip Girl. But basically, they all look really young. Like they all
Mm.
look so young on that show.
Yeah,
Have
good
you
lighting or what?
Okay, so you need to see these people.
Good skincare, good dermatologist.
So the
So you're saying they're
main
not young?
so well
They look
I think
young?
we should have you guess their age
Ooh,
based on
this
what
could
they
be
look like.
fun. This could be
Because in
fun.
the show they play a lot younger than they are in real life.
Okay, so you're not gonna tell me how old they play?
Well, no, let me show you because
Okay,
they're all
all
like
right,
different ages, you know. So,
all right.
like Penelope, the main girl in this new season.
Uh-huh.
Okay, perfect. There's a picture of her.
Yeah, she looks young. She's
So
got
how
great
old?
volume.
How
Really
old?
pretty lips.
Okay, how old do you think she is?
25.
Eek.
37.
She's 37.
What?
And on the show, she plays 19, which I
Oh my
actually think you could
God.
buy maybe 19 compared to maybe the other characters.
19. Oh,
I
wow.
know.
Okay.
Like, what is her skincare routine?
Yeah. She's got great volume for one.
Yeah.
She's got great hair. She does have great skin. And for somebody being as fair as she is, she must have done really well with
Sunscreen.
yes.
Yeah.
Because people that are as fair as her, they don't have much protection from
Right.
UV damage. So she must
Uh-huh.
have been really good with sun
I
protection.
think she wore a
Is
lot of
that I
sunscreen.
feel like is that photo? She almost looks like a little
No, I
editing,
think her
but
skin is actually
it's
that
actually really
smooth.
pretty.
Yeah.
She kind of reminds me of Nicole Kidman
Yeah.
because Nicole Kidman is, I think, 60s or something. Or
Right.
she's old, but she has
She also looks
beautiful
really good.
skin. And she's a runner, which always shocked me. But
Yeah.
if you've ever seen her run outside, she wears like this turtleneck.
Oh.
There's barely any skin showing.
But
She
have you
wears a
guys seen
visor.
the commercials about the AMC like theaters?
No.
Like her face doesn't move.
Yeah, well, it's years
It
of
does not
Botox.
move,
That's
but
true.
there's like a lot of really funny videos that
Yeah,
are
well,
kind
for a
of
while,
like,
her Botox was really everybody. It was like the talk,
yeah. Have you gone to like a movie theater in a while? You can actually,
No.
because I hadn't gone and then I went and this was actually the intro of it. So basically, she's like, welcome to the movie theaters, and you're like having popcorn, and this is where movies come alive. It's like a whole thing.
Yeah, and her face doesn't
Her
move.
face does not move. And
She's been
there's
frozen
no,
in time, and that's why
yeah,
her skin is flawless.
I know. It's really funny. I'm gonna show you some TikToks after this where they
So who else do we got?
Okay, so also, how old do you think Colin is?
He does have some lines and wrinkles around the eyes. He's got some on the forehead, so he's got to be at least in his 30s, if not late 30s, early 40s.
Okay, so you think he's like older?
31.
So I
I
actually,
said 30s.
looking at him, I thought
Yeah.
he was like young 20s.
No,
thought he
I
looked
think he
young.
has more volume loss around,
Ah,
like
the
starting to get a little
temples?
bit, yeah, on the temples. And he does have some fine lines. Like he's got some lines on his forehead. You see right there. And you see
Yeah.
how his brows are a little bit lower set. And, he's got that little glabellar crease coming in, the 11s there.
Yeah. Okay.
So,
So you were good on
yeah.
that one.
Yeah. His skin
Okay.
isn't as tight as like a 19-year-old. But anyways, okay. So who do you have next? This is fun. I
Okay,
like this.
so I want you to look at her. Simona.
Yeah.
I forget her name.
I would say she's probably, can you zoom in a little bit? Maybe mid-20s, late 20s. How old is she on the show? Oh, she's 29, but on the shows, she's
So on the
26.
show, she's 26.
Yeah,
Yeah.
yeah. Yeah, she's got beautiful bone structure.
Really beautiful.
Yeah.
Yeah, Lady Danbury.
And she's probably in her probably early 50s, 55.
Yeah, I think she's in her 60s. Right?
And how old is she? She's 61, yeah.
I love how on the show it says 60 to 70. It's like a range. Okay, so Eloise.
Eloise. So I think she's probably in her 30s,
I think Eloise is such a pretty name.
34, yeah. I mean, she again, she's fair
She
skinned, but
looks
she's
really
done
good.
really great with her sun protection. Honestly, I think that's the biggest factor.
Yeah.
And that's why you see more melanated, skin. They just age slower because of that built in.
Francesca.
Yeah, she's beautiful too.
She's actually like new on this season. Like it was someone else and they
I
just
would say
replaced her.
late 20s, early 30s.
Okay.
29. I'm getting better
Yeah,
because the
you're
first
doing
one threw
good.
me off.
Yeah,
I
the
don't
first one
know.
was hard.
First one, when you started off with a
I
hard one.
know. Because she looks so good.
I would
Okay,
say
so
late
this is the
40s,
mom. This is the mom
mid
of
to late
the
40s.
Bridgertons.
Wow,
Yeah,
56.
she
She
looks
looks
really good.
great.
She looks great.
See that? You didn't show me that
So
picture.
what do you
You
think
showed me like the
she
edited
what do you think
picture.
she's doing?
Let's take a look at her. So she hasn't really been getting Botox because I can
Around
see
the
she's
eyes,
got the
right?
lines.
Yeah.
She has good, what I call good fat genes, which means
Okay.
that you hold on to your volume really well. Some people do.
Good fat genes.
Yeah, some people lose a lot of,
Volume.
tissue, volume,
Okay.
whether that's fat, muscle tone, all of that. But other people really hold on to it, and she's held on to it. And she also has really good bone structure, which is the scaffold for things. She's got beautiful teeth, so she must have maybe done some, Invisalign or, kept up with her
Yeah, I think she has nice
ortho.
teeth.
Yeah, or maybe she's got veneers. I'm not sure. But she's probably done some lasers,
Hmm.
just based on the quality of her skin. Maybe some resurfacing lasers, maybe some radio frequency to keep things a little tighter, maybe some neck Botox, that makes a difference. But genetically, some people tend to accumulate more fat under the chin,
Under
which
the
can
chin.
give
Yeah.
their age away. But she's aging gracefully. Yeah, she looks
Perfect.
beautiful. All
I love how
right,
we
that was
took a little
fun.
tangent and talked
Yeah,
about
sorry, a little
Bridgerton.
tangent. We were all about the tangents.
Okay.
So we get so many questions from our
Yeah.
followers. Let's just jump in to first, what is the craziest thing you've ever seen when treating a patient?
Ooh,
Do
that's
you
a good
have one?
question. I think the craziest thing I've seen is mycobacteria in a tattoo. Have you seen that? No?
No, I
I've seen
haven't.
it like 3 times.
Oh, wow.
Yeah.
It's just contamination with the
Yes,
needle or
so
ink?
contamination, yeah. So I think it's something about the ink that they get. If you get a tattoo and then a few weeks to months later and start getting little bumps in it, there are many different things we think about. It could be a reaction to the tattoo pigment. It could
Yes.
be sarcoidosis, which is a very rare disease that we see in dermatology,
Mhm.
or it could be an infection. And this is a very important infection to treat, and it's harder to treat with like normal antibiotics. You really have to have infectious disease following these patients, and then they have to let the tattoo parlor know because
Yeah.
they don't want other people to get infected.
Well, speaking of tattoo,
Yeah.
did you see the recent study that got published about the increased risk of lymphoma with
No.
tattoo ink?
Oh, no. That's
Yes. And
interesting.
what's even more interesting
Uh-huh.
is laser tattoo removal is thought to be even worse
Oh my
because what
gosh.
happens when you laser a tattoo, you heat the ink, you
Right.
disperse the ink, but you don't
Oh,
actually get the ink out of your skin.
that's
It
true.
gets just dispersed, and then it's up to your lymphatic
To
system
drain it.
to
Yeah.
gobble up the pigment. It circulates throughout your lymphatic. You eventually pee or sweat it out with laser tattoo removal.
Mhm.
So I thought that was really
That's
interesting. And
really
the
interesting.
EU recently banned over 4,000 inks because
Wow.
of carcinogenic risk, which is why I'm doing the non-laser tattoo removal. I don't know if
Okay.
you've heard of Rejuvatech Medical. It's a company that we are developing a new way to remove tattoo ink directly from the skin so that
Really?
it doesn't get
Wow.
circulated into your lymphatic
That is so
system
interesting.
like lasers do. So it's a
Huh.
way that we extract the ink directly out of the skin using the body's inflammatory, response
Response.
system. And we've actually done biopsies like histology on the actual tissue that comes out of the skin, and there is tattoo ink in there.
What?
So I think I would be really cautious about
So would you get a
tattoo
tattoo?
removal.
Would you ever get a tattoo?
Would I ever get a tattoo? No. I like what Paris Hilton says. Why would you put a sticker on a Bentley.
Yeah. I know. I love that.
That is like my favorite phrase of all time. That's
Yeah.
because I know how hard it is to remove
Right.
tattoos. And honestly, you're not the same person you ever were. Like, there's enough things that have to be forever and
Right.
permanent that I think I can do with one less thing. I don't believe in like permanent things.
Permanent things that
Yeah.
you don't need to. Yeah.
Because we're all, self-evolving, but everyone has their own personal viewpoints. But well, especially after this research study,
Yeah.
I don't think I'll ever get a tattoo.
So I think a lot of derms don't really want tattoos for that reason, along with a lot of other reasons, like the infectious,
Yeah.
risk that a lot of people don't talk about, but I've seen
Also,
it.
it's harder to do skin exams. Like if you
Yeah,
have
it
a
is harder.
melanoma,
Yeah.
if you get a skin cancer and it's in a dense tattoo with lots of blank ink, good luck trying to
So
find
some
it. I don't
people,
really.
what some individuals do is they put a tattoo over their melanoma scar because the melanoma scar is so big.
Right.
But that's not good because then
Yeah,
we can't see if it's coming back.
that's right. Yeah.
So that's kind of
Lots to
hard.
consider
Yeah,
before, embarking on the tattoo journey.
definitely.
But before we get into the questions, I want to thank you for your listenership and subscriptionship. So don't forget to rate, review, and subscribe. Comment below. Let me know if you're watching Bridgerton and what you think the ages are. Do you think they look younger? Was I like right on? Or give me some feedback
Let us
here.
know. Let us know what you
And
think.
we love to hear from you. So if you have questions, follow us on Instagram at More Than a Pretty Face Podcast, or send us an email at morethanaprettyfacepodcast@gmail.com. Okay, so question number 1. Since this is now your podcast,
It's mine now.
you take over.
All right. So from Paulette, I'm curious about your thoughts on the best way to sleep at night to prevent wrinkles. I've heard on your back is best, but I know so many struggle with this. Any tips or tricks? Would love to hear your thoughts.
So I'm the worst sleeper because I sleep on my stomach.
On your stomach?
The
Is that
worst.
comfortable?
The worst.
How do you breathe?
I turn my side. I don't even know how I love sleeping on my stomach. Like when I was pregnant, I hated it because I couldn't sleep on my stomach.
Oh, interesting.
So I have tried every pillow under the sun. There's like,
yeah.
what is this one called? Glow pillow or
Yeah.
Glow Glam? What is it called?
Sleep
Sleep
Glow,
Glow,
something like
Sleep
that.
Glow,
Yeah.
yes, where it has like 2 little circulars on the edges. So if
Right.
you do roll over, there's a little opening where your
Yeah.
space doesn't touch the pillow. So I think that one is not bad. It's actually quite comfortable. Recently, though, I've been using a pillow by Flawless. It looks crazy because it's got like these 4 pillars like sticking out.
Oh my God. It traps you in there?
Yeah, it traps you in
It
there.
makes you
So it's
sleep.
like your face, and then it's like the 2 like pillars
That
that
looks
stick
very
out.
crazy.
So like it prevents you from rolling onto your side for one, but if you do happen, God forbid, roll over to your side, the pillars protect your sides of your face.
Oh.
And even with that pillow, I still roll over onto my stomach. I'm like,
Man,
how do
that's
I
so
do
funny.
this? So
That's
it's terrible.
hilarious.
Yeah. The best position is definitely your back, but I think using those silicone sheets too
Yeah,
might
oh,
be
yeah.
helpful.
The silk?
Silk
Silicone?
pillowcases for sure, but have you seen those silicone sheets that you put on like your chest where it keeps the skin taut? So even if
Like
you
the
do,
ones that are like people put on their like mouth and stuff? Like mouth tape?
no, that's
No.
mouth tape, but it's like these like silicone sheets.
Oh,
So
okay.
they
I
stick it
haven't
on the
seen it.
skin,
Uh-huh.
and then if you do try to crinkle up the skin, because the sheet has like compressed the skin and
Right.
prevents it sort of from crinkling.
Okay.
So I think those are not bad, especially for the chest or the neck. I think those are not a bad option.
Yeah, we love silicone in dermatology.
Yeah.
For
Do you have
scars.
any tips and tricks?
I sleep on my back.
Hate you.
I sleep on my back,
Of
but
course
I
you sleep
also,
on your back.
I also,
You're so
but no,
perfect.
I trained to do that.
You
'cause
did?
Yeah, I used to
Maybe
sleep
if
on
I
my
was
side.
younger, I could train, but I'm having a hard
You are
time.
young.
Yeah, I am. I'm only like 27, so I could
You're
start.
21.
No,
I'm
that
so
was last
confused.
year.
That was
That was
last
last birthday.
It's like the TikTok where it's like I turned 30 last year. Like
I'm gonna turn 30
in a year.
in a year.
And it's like, so you're 30. And it's like last year or whatever.
That's gonna be me forever.
Yes, we're not aging here.
No.
No aging on the
Not
More Than
on
a
this
Pretty Face
podcast. Not on the More Than a Pretty Face. Well, moving on.
I'm always excited to talk about
Since
Like,
it's
back to
your
dermatology.
podcast. It's
Yes.
your podcast.
So this is actually my podcast, and we talk about Bridgerton and Saltburn and Serena Carpenter. And
You are hired. You are now the host of More Than a Pretty Face podcast.
but it's not about
because I think
dermatology
it would
anymore.
be so much more fun
You
and
are fun.
relatable because you're like a normal person that watches shows like Bridgerton, Gossip Girls, and I'm
You're
like
watching it. Okay, so
the
what are you learning about in Gossip Girl right now? I want to know where you are because you're probably in the best seasons
oh God,
because it's
don't
like
put
the
me on the
beginning.
spot now.
Okay,
And
so
okay, it's like where they're going off to college,
yeah.
and like they tried to uncover who Gossip Girl is, but they
Okay.
couldn't.
Yeah,
Do we ever find out who Gossip Girl is? This is killing me.
you do.
You do? I just
You
have to
find
keep
out.
watching. Okay,
You
I'm
just
gonna
have to
keep
keep
watching.
watching.
Okay, I'll
I don't know if
report
I should
back.
tell you that or not, but you actually do. But don't look it up
Yeah,
because it might ruin it for you.
yeah. I love how they all like date each other, and it's like fine.
Yeah, I know. It's crazy.
It's
They
like they
all
just
look so
swapped,
good now too,
and they're
though.
so
Can we
hot.
talk
Like,
about Blake
can we just
Lively?
talk about Chase Crawford?
Wait,
Oh
no.
my
First,
God. Like
yes,
his
we'll get to
eyes.
him. But
He
Blake
looks at the
Lively.
screen and I'm like,
So let's look at Blake Lively right now. Let's pull up a picture of her.
she is so gorgeous.
She's so
And I think
gorgeous.
her
So what-
personality makes her even prettier. We have the most amazing podcast community, and we want to thank you for being such a loyal listener. To thank you for being a fan of the show, we want to extend 15% off exclusively to podcast listeners. Just use code SUMMER15. That's SUMMER15. This is a special discount we're only giving to our podcast listeners to get 15% off your favorite products at AussieMDSkincare.com. Don't forget to tag me in your stories. I love to see you glow.
So what do you think she's done to her face? Because she has not aged. Like if you look at Gossip Girl and then you look at a picture of her now, there's no difference. And she's also had multiple children.
Yeah, well, she definitely has
Oh my God,
great
she's so
bone
beautiful.
structure, and I think she's done some lasers. I don't think she's done a ton of Botox,
So
but
I
maybe
think
a
like
little
with her
bit.
skin
Yeah,
type, you could do CO2 and not worry
that's
as much,
right.
right?
Yeah,
So
yeah.
she's probably had
She's probably had some
lasers
ablative lasers for sure. Yeah,
and probably like maybe once a year or something.
Yeah.
That would have some downtime.
maybe some radio frequency.
Yeah.
Maybe she's had a little bit of fillers, I think,
On her cheeks
around the
and lips.
temples, maybe
Yeah.
around the eyes, just to
Maybe
kind of
Sculptra.
maintain. Maybe a little Sculptra for biostimulation.
She probably had under eye filler.
They all deny it, guys, but let me tell you, they do stuff.
I mean, maybe she hasn't gotten anything. This is all
They
speculation.
do. I think
But
maybe she hasn't. Maybe she hasn't.
I
Maybe it's
think
just
she's
really good
probably
makeup
doing
and lighting.
something. Yeah.
We
just
don't know for sure.
because
We are
we don't know.
just
But
we are
we're
just
speculating. But we love
pretending.
her. We're
We
on
love
her
her.
side.
Whatever she's doing or she's
We
not
want to
doing,
know.
keep going
Yeah.
because it's working, girl. It is. You are
It is
hot
working.
and looking really good.
Oh my God. Okay. So let's
Oh,
talk
this
about
is the man of my dreams.
what? Your husband's listening to this.
Oh my God, he never listens to the podcasts.
Aw, yes, he does. He's the #1 subscriber.
The man of my dreams
I
is
think
my husband.
on his way to work,
He listens every
he's
morning.
listening.
Honey, if you're listening, you are way hotter than Chase Crawford. Way hotter, for sure.
Yeah.
Definitely
different
have
look.
better. You have
He's
better.
like a Persian Chase Crawford, actually.
Yeah, yeah, honey. He's like the American
It's like
version of
Chase
you.
Crawford goes to med school.
Yeah,
and is
and
Persian.
becomes a cardiologist, and then converts to being
Yeah.
Persian.
So can we talk about how I copy your life?
Yeah, you already have, by the
Remember?
way.
Literally. And I
You
also
just you just
copy
try
your
to
life.
copy me. This is the thing. She copies me, guys. Okay, get this. So she's derm, and she married a cardiologist.
Wait, hold on. No, you have to like go back. You have to go back. So
Copycats,
basically,
okay?
Dr. Ozzy is
I became a
Persian.
dermatologist. You became
Wait,
a
no,
dermatologist.
wait, back up.
I
wait,
married a
back up.
cardiologist. You married a cardiologist.
I can't tell if you like me or hate me.
I have a podcast. Now you're the host of my podcast.
Yeah, well, it's my
And
podcast.
I got
so.
married July 15th.
I got
You
married
got
July
married
14th.
July 14th. Come on.
Yeah.
Come on.
I
You
know.
gotta stop. It's just killing my game.
What's it called? Like when you copy, it's like actually flattery or something.
Yeah, you're such
Yeah.
a copycat, but I'm flattered.
Yeah.
I'm so flattered.
I was like, what do I do to be Ozzy? Find Persian cardiologist husband. Check.
That's right.
Be a derm. No, derm was first. So
Yeah,
be a derm.
That's right. Be a derm.
Then find Persian cardiologist husband. And then yeah, that's it, I guess.
Have a podcast. Just take over.
I know. I'm just gonna like take it over sometimes.
I love it. I love it.
Okay, so we should go back to the questions.
Okay.
So from Chantel, I saw you recently said it's okay to start Botox at 27, but to take breaks. Why take breaks? How long of a break?
Okay, there's one thing you should know about Botox is that when you start doing it, you're going to start to change your muscle dynamics. It's like any other muscle. When you have Botox, that muscle is not working. So what
Right.
happens to that muscle? It gets weaker.
Mhm.
What happens to the muscles that are not being relaxed? They get stronger. So you start to see this shift and change in the strength of your muscle groups.
Right.
And so you want to make sure that you're taking breaks because you don't want to atrophy that muscle. And what I mean by breaks is initially you do want to train the muscle. So when you first start, you're going to have really strong muscles, right? And so you want to go in every 3 months because you really want to train the muscle
To
not to
stop
move,
working.
to stop working so that you're not crinkling up the skin. But let's say, and it's different for everyone because let's say after a year, after 2 years, maybe it's after 5 years, it's going to be different for every person. You'll notice that it'll be like 5 months, 6 months, and you still can't frown.
Yeah, you, like, still don't make the
You
movements as
still
much.
don't
Yeah.
make the movements. And so that's when you know you need to slow down. You don't
Mhm.
need to go in every 3 months if that muscle is not working at 3 months, you
Right.
know?
And I'm sure you've gotten this question a lot too, but people are often like, if I get Botox, do I have to keep doing it forever and ever? And I have to keep going every 4 months and I have to keep doing it? Like,
Well, at some
yeah.
point that muscle is going to atrophy.
Yeah.
It's going to thin out. It's going to pretty much stop working. So it's going to forget
Right.
how to make that frowning
But someone
motion.
could just do it once and then never do it again.
That's right,
That's
yeah.
something they could
You could
do.
do that. I mean, there's no rule
Yeah.
on how you should do it, how often you should do it. But I guess my general recommendation would be if you're super expressive and you're already starting to see
The lines.
lines,
Yeah.
then go in consistently because
Like the
people,
lines at rest,
but then you
right?
have the other extreme of person that says, well, my own Botox only lasts for 2 months. Well,
Hmm.
that's true because after about 2 months, the muscle starts to regain strength. And by 3 months, it's back to where it was. Like,
What can't you do after Botox? Like, what are things that you tell patients you can't
so you
do
don't want
it?
to lie flat. Usually I say 4 hours, but that's the only
Okay.
restriction I have. Now, if
What
you, a
about
lot of,
exercise though?
I feel like you can exercise as
Really?
long as you're not lying flat to exercise. I think it's
Okay, what
fine.
about massage
Well,
on the
again,
face? A facial
I think
massage?
it's fine. I don't have a problem with it.
Really?
Really,
Wouldn't it
to
move
be
the
truly
Botox
honest, I mean, it gets absorbed within an
so
hour. So we're
quickly?
being extra cautious when we say don't lie flat for 4 hours.
Mhm.
But the other thing people don't know, if you want your Botox to kick in faster and stay active longer, work your muscle
Or
groups
zinc, right?
or zinc. You can take zinc supplements a
Mhm.
week before, after. But right after you get your Botox, try to contract and relax your muscle 10 to 20 times
Mhm.
because the protein gets picked up more
Right.
effectively.
That's
So I
exactly
hope that was
right.
a good explanation, but just, go in when you see the muscle groups working again. So if you're not frowning, you don't need to make your Botox appointment.
Okay, this next question is really interesting. So, Natasha was asking, what are your thoughts on mesotherapy? It seems to be a very popular thing outside of the US. And I also think that no one really does it around here. And
Mhm.
I feel like it is more popular outside. So, what are your thoughts on it?
Yeah, so mesotherapy really just means delivering ingredients or actives through a device that has multiple needles. So essentially, you're delivering a cocktail, if you will, or a solution to a certain depth in the skin. And that is to either rejuvenate the skin, or some people use fat melting solution to, get rid of the fat layer or a bulge in certain areas. So that would all fall under mesotherapy. And so the way we use it in our office is I like to make a cocktail of PRP and hyaluronic acid because studies have shown by combining those two ingredients, the hyaluronic acid actually amplifies the effects and the growth factors that are seen in PRPs. You're delivering a more enhanced PRP, if you will. Plus, the hyaluronic acid helps plump up the skin, hydrate the skin. And we deliver that through what's called a mesoram. So we mix in, PRP, hyaluronic acid, and we put it in this little mesoram that then injects or goes into the skin. And it's several needles that is put in at once, and it goes into the top layer of the skin. And it's just a good way to enhance your treatment. So it
Okay,
improves skin quality, helps with skin laxity,
amazing.
cellulite, things like that. Yeah.
This next question is kind of interesting. It's Josie from Instagram. Hi, Dr. Shazi and Dr. Mina. I lost a little over 40 pounds recently, And at 42, when I look at myself, I feel like I've aged even more. What are some things you recommend that I do to feel better and more youthful?
Well, I think you can do Sculptra. I love Sculptra for somebody who especially is thinner everywhere, but needs more volume in the face. So Sculptra, I love Voluma, Volux. Those are great at replacing and restoring
I love
volume.
those. Yeah, I think those are
And,
great.
those fillers are really, and they stay for a really long time.
I think when you think about volume loss in the face with weight loss, you have to think about sculpture fillers.
Yeah, for sure. You really need it.
That's amazing that she lost 40 pounds, and I
That
think
is
that's incredible.
amazing.
Um,
Congratulations. That
and
is hard to do,
that's
you
very
guys.
hard.
40
Also,
pounds.
yeah,
That's incredible.
separately from this, I feel like a lot of patients I see on Ozempic have been experiencing a lot of weight loss and also a lot of like hair loss with that too.
Yes.
But also, there's something online called Ozempic face that people
Mhm.
often talk about. So, what are your thoughts on that?
Yeah, there's definitely a component to it that can almost like accelerate aging. Well, we
Right.
know how important volume and fat and tissue is for the face. Like the French say, it's either your butt or your face, right?
I really think like when people talk about Ozempic face, it's actually or losing it's basically losing a lot of weight and
Yeah,
quickly and what that does to the face
right.
once you lose
And so
volume.
that you're losing that plumpness, that cushioning,
Right.
that fat layer that goes under the skin that makes us look, brighter and more youthful, and it diminishes the harsh contours of the
Right.
face. And so I think that is certainly has a big part of it. But is there something else going on
Mhm.
metabolically that perhaps, affects your collagen or your elasticity or your
Right.
hyaluronic acid? All of those other factors are at play
I feel
too.
like a lot of the hair loss that I see is mainly nutrient based.
That's right. And could nutrients, again, that's a good
Yeah.
point, could be playing a role in this too. So I
Okay.
think if you do Ozempic, you really have to be careful and do it in a way where you're not going to have a lot of rapid weight loss all at once. And you're also going to make sure you're getting all the nutrients that your body needs. And
Right.
certainly that's important for the skin because again, collagen is a protein. It needs amino acids. So if you're depriving your body of that, guess what's gonna get compromised first? Your skin.
I also
Your
feel like protein is so important for hair growth. Like,
and for hair,
so
yeah.
when someone has hair loss, what are some labs you check?
So I definitely would do the thyroid hormones. Vitamin D is a big
Mhm.
one because I feel
Yeah, it
like a lot
definitely
of
is.
people have vitamin D associated hair loss.
Mhm.
And then ferritin, which
Mhm.
is an iron protein, even though iron could be normal, your ferritin levels, which is the iron protein, could still be low, even though it
Right.
could be normal. We want it above a certain level.
Right.
Do you add anything else to
No,
that?
I wouldn't add any other labs. I definitely think it's important to look at protein in the diet and a lot of other things. I think that there are natural things that help, like turmeric, like which is in a lot of our foods, like we were talking
Mhm,
about on the last episode. It's in a lot of Persian foods, a lot of Middle Eastern culture. So I
mhm.
think that's important as well. So going on to the next question. So Rose asks, how do you mix retinol with minoxidil for hair growth? I actually just put a video out on this. It's not complicated at all. You just take minoxidil 5% foam and then you add a retinol or a retinoid. I like adapalene, which is an over the counter retinoid. And then you just mix that together in your hand and then you just apply that directly to the scalp. And then you just like make different lines on the scalp where you would apply it.
Yeah, and different is a gel, which
Hmm.
makes it easier to apply on the scalp.
Right. Than a
And
cream because a cream is so messy to
just be
apply.
cautious because sometimes you might get a little irritation.
Right.
But the foam is less irritating than the solution.
Yes. Yeah. And then there are some questions on my Instagram that I wanted to pull up. So let me get those out. So I got some questions on Instagram that people wanted us to answer. What are your favorite body scrubs?
Oh, well, I don't really use body
I don't
scrubs
really use a
because I
body
use
scrub
the one
either.
spray. It's so because I'm
Yeah.
lazy. The one spray, do we have it here? The one spray is so easy for me. I just spray it on my legs. It exfoliates, it
I love
smooths.
it.
I don't have time to like
Scrub.
scrub, but I guess I would
So what do
use
you think
one if
about
I had one.
what do you think about dry brushing? I get this comment all the time.
Yeah, people use it. I mean, it's not bad for circulation and so forth, but I kind of have sensitive skin, so I think
I feel like it could be
it
abrasive.
could be
Yeah, a little bit.
abrasive. I think if you've got pretty tough skin and if your skin tolerates it, it's not a bad thing. But
Yeah.
for me, I'm all about chemical exfoliants in general because I do think they work at a cellular level. The
Hmm.
benefit of body scrubs is that you get more instant results,
Right.
right? It nourishes. A lot of them have oils and things in them, so it's like a exfoliant and a moisturizer in one. I mean, I never buy them because I always
Right.
use the one spray.
Yes.
But hey, send me body scrubs if you're listening and you make one.
Okay, so does Differin gel have the same anti-aging benefits as a retinol?
I think that retinols or tretinoin is better for anti-aging. I think adapalene is better for acne, but it does do some like
Right.
texture and smoothing of the
I think it's
skin.
important to compare. There's retinol and then there like in the strength. So there's retinol and then there's adapalene, which used to be prescription, different, and then there's tretinoin.
Yeah, they act on different receptors in the skin, so they're not, the same.
Okay, so is it better to use a stronger tretinoin less nights or weaker more?
Consistency. I think that in order to see results with retinols, you have to use it at least 5 times a week.
Okay, I agree
One,
with
you
that.
have less side effects because
Yeah.
if you stop and go, you interrupt that cellular renewal process that we want with
Right.
retinols.
Yeah.
So I think lower strength and work up to a higher strength. You don't need
I
to go
agree with
so
that.
super high.
I
Sweet
agree.
spot is about
You don't want
0.05,
your
I
skin to
think.
be irritated, so you
Yeah.
wanna do whatever your skin's comfortable with. So, tretinoin seems to make my KP worse. What do you think about tretinoin for KP? They say too much cell turnover, lower strength. I don't really
It's
go
not my
straight to
first.
yeah,
Yeah,
I
it's
don't
not my
really
first
go with
line.
that straight to KP. Is a peptide serum good for mature skin?
Yeah, it's great. Peptides are suitable for all skin types. They sort of trick your body into forming new collagen and
What's your favorite
renewing.
peptide serum or moisturizer?
Well, I use Restore
Mhm.
from Aussie MD
Yeah,
Skincare,
I love that one.
and it has peptides, it has stem cells, it has niacinamide, resveratrol, green tea. So I like that one.
Perfect. And then the last question was using AHA, BHA toner with vitamin C at the same time as the night routine. I think they're just asking like, would you use AHA, BHA toner with vitamin C at night?
So it depends on the strength of that toner, right? Because there are AHA, VHAs that are really mild.
Right.
And it also depends on your skin type. So if you've got super, tough skin or oily skin and you can handle it, then, by all means go for it. I personally don't think you need AHA, BHAs every day. I think you
Right.
can just use one once a week. I mean, you don't need to exfoliate your
You don't want to do
skin.
it with retinol at
Yeah,
the
and
same
and
night.
I personally use Clarify pads, which has 2% salicylic acid and 2% glycolic, one night a week or sometimes
Okay.
2 nights a week, but I do skip my retinol.
Right.
Yeah.
You don't want to use it on the same night.
And I only use vitamin C in the morning
Mhm.
because I feel like if I use it morning and night with a retinol, my skin is gonna be so
What I
mad
feel
at
like
me.
what people don't realize is that vitamin C works with your sunscreen to make your sunscreen more effective,
Yes,
basically.
that's true.
So it's important to use that in the morning, and you don't want to be doing that. A lot of people use it at night, and I really think it should be used like exclusively in the morning.
Yeah, I agree. I mean,
Yeah.
you can use it up to twice a day, but it's like, how many actives are you gonna use at
Right.
once? You don't
That's
wanna
true.
overwhelm your
You don't want
skin.
to
But
overwhelm
if
your
you had to
skin.
choose morning or night,
Choose morning.
choose morning.
Yeah.
All right, guys. Thank you so much for tuning in. Until next time with Dr. Mina and Dr. Ozzy.
Bye.
Bye.